The president's unproven claims linking acetaminophen use in pregnant women to autism may be a step too far for some of even his closest allies, including the vice president.
What I took from the president's announcement and also the CDC recommendations here is that we just have to be careful. My guidance to pregnant women would be very simple, which is follow your doctor, right? Talk to your doctor about these things. But ultimately, whether you should take something is very context specific, and that's why I think you should lean on your doctor.
Pregnant women know lots of the typical things you would take for aches and pains and fevers are not a permissible product to be used during pregnancy. The acetaminophen is probably your best option, but take it when you really need it.
My view is we ought to be very guarded in making broad assertions and make sure that they are well grounded in science and medicine, and where we're taking the consultation advice of experts in the field and ensuring that these things are all well documented.
NBC's Hillyard has the latest reporting for us. Also with me, global health policy expert and MSNBC medical contributor, Dr. Vin Gupta, and Tara Setmayer, co-founder and CEO of the Seneca Project and former Republican communications director. Vaughn, what more are you hearing from the White House and Vice President Vance?
Right. Well, we haven't heard much from the president specifically himself since that press conference where he struggled to name the ingredient in Tylenol and made a direct effort to convince women that when they are pregnant that they should not take Tylenol at all, which was undercut by Secretary Kennedy, who then took the microphone and stopped short of saying and going quite that far. But I want to let you listen to more of his vice president. They're suggesting that women should follow the advice of their doctors. Take a listen.
If you're talking about a case of very high fever, of course, you're going to have to take something to deal with that. So I really think it's case by case. But if you zoom out a little bit, the fundamental argument that the CDC is making, that Bobby Kennedy is making, is that these drugs do have side effects. And we've got to follow the science wherever it leads. If the argument is let's come up with more evidence and let's do more science, then I'm absolutely on board with that, because I think that, this is how science actually works.
And so this is a question here for the administration going forward, is exactly what else are they going to do in terms of research and ultimately providing clarity and also directives to the American public, one that the President of the United States called into deep question just earlier this week. And of course, there's a further question of what other initiatives is this administration under Secretary Kennedy going to put forward beyond just questioning acetaminophen, but actually looking at other areas that they will intend to make announcements about. There's a lot of questions here for HHS.
Well, let's be clear, Tara, about exactly what the president did say about Tylenol. Here's a compilation from that press conference.
Taking Tylenol is not good. All right, I'll say it. It's not good. Don't use Tylenol unless it's absolutely necessary. But with Tylenol, don't take it. Don't take it. You'll be uncomfortable. It won't be as easy, maybe. But don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born. Don't take Tylenol. Fight like hell not to take it.
Does it, Tara, have any political impact for the president when some of the people closest to him are distancing themselves on this issue, and or what Americans are hearing from him, American women in particular, is not the same as what they're being told by their OBGYN?
Yeah, what we saw was an irresponsible, reckless display of medical quackery by the president of the United States, who has absolutely no expertise in this area whatsoever. Not only does he not have expertise, but he's spreading misinformation that could be dangerous for women and for women who are pregnant and their babies. I mean, shame on anyone that's standing there next to him, knowing that he's making these unsubstantiated claims based on junk science. And, it's very frustrating, especially for those of us who are women, who run women's organizations like I do, to see them making these claims that put women's health and women in danger. And where are they going to go next? Are they going to criminalize pregnancy? Millions of women take Tylenol during their pregnancies because it has been deemed safe to do so. And to make a false link like this, it is in line with the agenda that they've had that is an assault on women's health, assault on women's reproductive health, and it's not going to stop here. They're also trying to push for banning mifepristone, which would deny millions of women safe abortion care and safe care for miscarriages. So again, the concern here politically is when, as women see this and they see the way that Republicans are handling it, it is a threat to our lives and our health, and it can backfire on them, and it should. They should be listening to their doctors and people who are trusted voices, not medical quackery coming from Donald Trump and his conflicted cabinet, who know absolutely nothing about what they're talking about and spreading misinformation.
So let's go to our trusted voice, Dr. Gupta. So when you listen to J.D. Vance and he says, consult with your doctor, and Senator Thune says that, what the vice president said is, but he's all in on more research. Maybe we need more science. Do we need more studies, more science, more research to tell us whether or not Tylenol can be useful in certain circumstances when women are pregnant?
Well, Chris, first of all, thank you for having me. The short answer is, of course, more research to understand and to reassure. No one's going to say no to that. But the question is, do these questions have to be asked? I'm sitting here in an ICU on the West Coast, and American patients, just like Tara pointed out, there's women in pregnancy, which is the issue at hand right now, patients across the spectrum, of illness, of just dealing with any number of things. They already have so much to deal with, and they have a lot of other stressors. And what this administration is doing, the irresponsibility of it, is they're causing more anxiety and more confusion. And there's enough that the doctor and with their patient have to discuss when it comes to real medical concerns and medical problems, access, affordability, making sure that in the case of somebody undergoing pregnancy, that happens safely and that baby is doing well after birth. This is not a question of all the challenges in American healthcare. Chris, you and I have been talking about this for 6+ years. This is not a question that was in anybody that is following the science, anybody's top 100 issues that we need to contend with. There's a lot of challenges in healthcare. This is not one of them. So if you ask me, would scarce resources ever more scarce because of this administration, should it be dedicated to finding new solutions for cancer, investing in promising vaccine technologies, making sure that people have access to Medicaid, versus putting more resources into wondering whether or not Tylenol is safe in pregnancy? The answer is I'd rather the former than the latter.
So, Tara, Trump's approval rating has been hovering around 43%. There's this new poll by the 19th that not only shows that, but it also shows a huge gender gap among women. And we know in the last election, Donald Trump's election was driven by men, particularly young men. And now we're seeing this gender gap growing. Should all Republicans who are going to come up for re-election in a way that he is not be worried about this right now?
Of course. I mean, this is why Republicans are trying to rig the midterm elections with mid-decade redistricting. They know that they are in trouble because a lot of the promises that Donald Trump made to the American people, he's not fulfilling them on economics, on all these other things to improve people's lives. He's betrayed the American people to line his own pockets and to do favors for his billionaire buddies, which make up the majority of his cabinet. And he's fixated on a retribution tour. So Republicans who are running for re-election in the midterms are trying to figure out how to navigate this. Unfortunately, a lot of Republicans are tripping over themselves to see who can suck up to the president more and be more MAGA than they are pushing policies that actually help the American people. And for women in this country, the effects of the betrayal bill that got passed on our health care, on our access to health care, rural hospitals, childhood cancer, all of these things are being impacted by Donald Trump in ways that really are difficult for the American people, particularly women who are often the heads of households and making the healthcare decisions. So sure, Republicans have to try to figure out how to navigate this, and women should and are, as you see in this polling, coming out and speaking up and saying, wait a minute, this is not what we voted for, and they should pay the price at the ballot box for it.
Doctor, I read a lot of articles about this this morning and about the reaction to what the president had to say about, how some Republicans are breaking with him. But there was something else that really struck me, and it was in the New York Times. And they report that the president's message is worrying some mothers, that it could create unnecessary guilt for parents. Is that a real thing and a real medical concern in and of itself?
Absolutely, Chris. People now are wondering. I've gotten a lot of this outreach. I know my colleagues in obstetrics and gynecology are very worried about this, where now moms will say moms are already under a lot of stress and have to deal with a lot, especially undergoing or making sure that they have a safe and healthy pregnancy. And now we're adding yet another barrier for them to want to access care, which is guilt. There is no reason that a mom can't take Tylenol to treat pain or a fever. They should be doing that, because both those things, if mom's not well, baby is not well. And so it's important to recognize that. But if you're adding this layer of guilt, and mom's already going through a lot of those challenges, then that's definitely going to pose an access barrier here. Absolutely. And I should also just say more broadly, some of the challenges that I think moms are facing are this concern for simplistic solutions to what is a complex disorder. Autism is complex causes. And this administration is looking for a simple set of solutions here, like giving folate to moms, which they, by the way, already take, and pretending like that's a balm or a catch-all solution. It's comical. I wish it wasn't comical. It's tragic. But they're looking at these simplistic solutions as though it's some balm here, and it's anything but.
Tara, President Obama actually spoke about Trump's claims yesterday. He says it undermines public health and that it's violence against the truth. Barack Obama picks and chooses very carefully when to jump into the political fray. Why do you think he chose this? I mean, the first thing I thought, maybe it's overly simplistic, he's got a wife and 2 daughters.
Yeah, and I think that as a girl dad, right, he probably sees that, he has daughters that may have children, one day, and doesn't want our American health system being co-opted by people who are spreading lies that are not based on real, legitimate science. So I'm glad that he's using his position and his voice, because it's powerful and it matters. And I think that for a lot of American women, they don't want to be lectured by a bunch of men in an administration that the current administration telling them to tough it out. Coming from, Donald Trump, who can't even take a joke. You want to talk about tough it out, telling women to just tough it out and then, cause more anxiety, to Dr. Gupta's point about pregnancy. It's tough enough for women in this country. So I'm glad to see Barack Obama coming out, speaking out. We need to see more of that and more of and where are the women? Where are the women elected officials? Where are they, particularly Republican women who know better? We should be hearing from them calling this out. I'm glad to see Senator Thune was willing to call out Donald Trump on this, but he won't definitively say that Trump can't run for a 3rd term. So we need to be very cautious of the messengers and who's lecturing women about what they should be doing with their bodies.
Dr. Vin Gupta, Tara Setmayer, thank you both.